professors and colleagues, the call for active learning and critical thinking at all educational levels and situations, from students to fellows in training and from classroom to the bedside, necessitates the shift from traditional teaching to more learner centered ways of teaching. Case based discussions are well known to promote active learning, critical thinking, and higher order processing, such as knowledge application, analysis, synthesis, and evaluation. So let's go through a quick journey about discussion sessions based on clinical cases. The objectives of this video are to recognize the importance of case based discussions in medical education, to recognize tips for writing good medical cases, and to identify steps of case facilitation. Now let's start with writing medical cases. The following are some practical tips on writing a case that engages learners in active learning and discussion. The first phase is during case preparation. First, identify the case goals and objectives. That is to say, start with the end in mind, or in other words, apply the concept of outcome-based education. Next, identify the level of learners. So facilitate the movement from novice to mastery, and take care that aiming the case at too low a level can feel insulting, and conversely, overestimating learners' understanding might increase their confusion. The second phase is on writing the case. Please try to bring realism to the content using the following tips. Use active and colorful language to create realistic cases. For example, name the patient, give him a unique occupation, and use relevant descriptions. Use the patient's own descriptions rather than medical language. This way you can transfer learning from case reading and discussion to practice of medicine. Allow learners to interpret radiographic and laboratory data themselves. Don't deprive your learner from opportunities of higher order thinking, problem solving, and decision making by merely presenting information and interpreting it for him. Allow for natural discovery rather than presenting information chronologically. We all know that most of the patients present their clinical history out of the chronological order. Do the same on writing your case. Be realistic about interruptions in patient care. You know that many patients don't return for follow-up appointments. Incorporating this into your case will present the learners with a complex real